Immigration into the United States has been going on throughout the nation's history and has led to the creation of the diverse country it is today. Immigration has been a major source of population growth and cultural change throughout much of the United States history. The Chinese Exclusion Act of 1882 prohibited virtually all immigration from China, the first immigration law to do so on the basis of race or national origin. Minor exceptions were made for select merchants, diplomats, and students. The law also prevented Chinese immigrants from naturalizing as U.S. citizens. The first major wave of Asian immigration occurred in the late 19th century. Asian Americans experienced exclusion and limitations to immigration by the United States law between 1875 and 1965, and were largely prohibited from naturalization until the 1940s. Since the elimination of Asian exclusion laws and the reform of the immigration system, there's been a large increase in the number of immigrants coming to the United States from Asia. However, coming to the United States and navigating many aspects of living, such as employment, housing, healthcare, and transportation can be quite challenging if English is not your native language. According to the Office of Minority Health, approximately 19 million Asian Americans live in the United States. Of those, 31% are not fluent in the English language. Being an immigrant in the United States is not a simple process for many reasons. In particular, language barriers for immigrants can cause a wide range of complications. We had the opportunity to gather first-hand accounts from immigrants of different countries in Asia and their experiences navigating the immigration process and the language barriers in the United States. Here are their stories.
你好，谢谢接受我的访问。
你好，我是葛凤鲁。
你好，我是郑树金。
我们第一个问题是，你们在哪里出生的？你们几时来美国？跟那个过程是怎么样的？
我是在台湾出生的，我是1991年来到美国。刚来美国的时候，所遇到的第一个困难就是语言的困难。
我也是1991年来的，我是因为我先生他们是移民，所以我就跟着过来了。当然啦，来的时候都是因为语言的关系，所以就是比较辛苦一点。
Me in my traditional outfit.
My name is Yoko Jithon Nguyen. I'm Vietnamese. I was born in Wales. My family is originally from Vietnam. Honestly, living in Vietnam, my family grew up stupid poor. She started off with not really fully knowing who her father was because she was a war baby. My grandmother tried her best to raise her and her sisters to kind of be happy with what they could have. So because my mother is a Vietnam War baby, I was kind of already granted citizenship. Same thing with her after that law passed too, where like war babies are also considered Americans.
Vietnamese being like your first language, learning English, but like growing up learning the two at the same time, like what was that like?
Learning with both of them at the same time was definitely very cool at first. I ran into my first trouble at school in 4th grade when the teacher started asking questions and we all had to kind of blurt out answers, and the kid who answered, like got like a prize. I started answering in Vietnamese and I wasn't realizing it. The teacher called my mom into the school and then talked to her about it. And then she highly suggested that I stop learning Vietnamese. I honestly had to do everything from a very young age. I had to help them out, kind of be their translator and do the paperwork for them. All they had to do was sign it. And growing up, I thought that was kind of just me. But as I've gotten older, I've learned that other like POC children did that for their parents too. It falls especially on the firstborns pretty often.
Well, my name is Fei Sun. I'm a professor with social work. My primary research interest is mental health and aging, with a specific focus on old Asian Americans, more specifically Chinese Americans. But most of my work is research, so I conduct community-based research projects that are involving, old Chinese Americans. Some of the research are observational, just involving like a survey study or qualitative interview studies of them, just one time. But other studies are involving like interventions with them. So in those cases, I will work with them over an extended period of time.
What common challenges have you witnessed Asian American immigrants face in the United States, particularly in relation to equal access to housing, employment, health inequalities, or income inequalities?
Most Asian Americans, they have, I would say, two major barriers. One is related to the language. As you said, for the old Asian Americans, close to 80% of them were not born in this country, so English is their second language. Because of the language barriers that affect their access to healthcare and other social supportive services. Then the second language I would consider is the transportation barriers. That's a very critical one for Asian Americans as well, particularly for older adults. They typically use a metaphor, say, I have no mouth, I have no legs. That refers to the language barrier and the transportation barrier. So speaking of Chinese, old Chinese Americans, many of them were immigrant from like mainland China or Taiwan or Hong Kong. So in those places, the public transportation system is typically available. So they are used to use public transportation to get where they go. But however, in the United States, they do not, particularly in those cities where public transport, even including Lansing, the public transportation is not that accessible. So they'll have those challenges.
Asian immigrants in the U.S. are far less likely to have health insurance or use healthcare services in comparison to U.S.-born citizens. Asian immigrants who have access to U.S. healthcare systems are less likely to receive high-quality care compared to U.S.-born citizens with English as their first language.
为了医疗保险，你们什么难的？
来美国最重要的就是要有一份医疗保险。当初我们在申请政府的医疗保险的时候，因为语言的困难，我们就接受我哥哥的帮助，还有朋友的帮助，在他们的帮助下，我们顺利了拿到政府的医疗保险。
For senior old adults, they immigrate here largely because they want to be reunited with their adult children. The adult children typically are able to speak English. However, because they have full-time jobs, they may have younger kids to raise. The old parents, they are afraid of disrupting their adult children's life. So they're minimally seeking help from their adult children. So they have to rely on the formal system for those kind of help. If they are on social welfare programs like Medicaid, or even Medicare, they are guaranteed with access of language services when they seek healthcare professional. However, I will have to mention some of the telephone translation. Though it's synchronous, it's live, it's like three-party conversation. You are talking with someone who is translated over the phone, and that person talks, they may put on a speaker, then the person translates to the health provider sitting across with you. However, some of the translation can still be lost, during the process, because the person on the phone, they may speak the language, but they do not understand the dialects, do not understand the cultural nuance. Some of them could be born in the U.S., but they're trained to speak Mandarin or Chinese in this case. They are not able to fully understand the meaning between this. If an old person complains about pain, say, "Oh, I have stomach pain or I have leg pain," and the doctor asks them to describe the severity of the pain. In the U.S., you are very familiar with using a scale from 1 to 10, or you're describing to me. But in the Chinese language, we have different terminology to describe the pain. It's like it's a little bit complicated even for me to translate it. So it could pose a challenge for the translator in the end of the phone. And then the process is sometimes we have a senior companions Those senior companions can be, some of them are peer companions, they are similar ages, but they immigrate here much earlier, and they are at least fluent in English, so they are there as a friendly companion to help those elders with translation. And sometimes we have to be creative to either ask the adult children to be involved to help the parents to go to see the doctors.
I'm Hyung-Gak Cho. I'm associate professor in the School of Social Work at MSU, and I've been here since 2007. So because like the explaining or describing whatever symptoms, it's kind of cultural thing, right? So it's so embedded in our own culture, so it's very hard to describe in like the American terms, although like it's quick translation, but it's different. So, and like whenever we try to give like additional information about what we're trying to convey to provide, and they sometimes like take that as a language barrier, not like a cultural, like something that we want to provide context. So also they didn't have time most of cases to listen to us. So they quickly give us some diagnosis, but it didn't result in terrible results, but overall process of getting help that we needed, oftentimes very daunting.
Asian immigrants often face prejudice and discrimination from others in the workforce due to their language barrier. They may have difficulty adjusting to a new culture, language, which can lead to complications in the search for employment and housing. Asian immigrants have a lower home ownership rate than the U.S. public overall. While the home ownership rate is on the rise among Asian immigrants, immigrants are less likely than U.S.-born citizens to own a home.
谢谢。关于找工作，你们是什么困难？
因为刚开始刚到美国的时候，为了生活，我们一定要找一份工作，但是由于语言的困难，所以我们只有在家附近的中国人的餐馆找工作，然后时间的累积，使得这个英文的进步，我们在想说能不能从美国政府取得一份工作。
现在的工作是什么？
我现在在邮局做事。
They opened up the first nail salon around, I think, 3rd grade, so I was about 7.
Did anyone else help them like start that, or?
No, it was my mother working at another nail salon, getting the training and the customer base, and then my dad just worked multiple shifts working at a factory job. On top of that, I have been helping out with their paperwork for the businesses, getting like their licenses and everything since as long as I could remember. My mother already had a basis of doing nails because when we got to America, she kind of like went really quickly and hopped on that bandwagon because that was like the hottest trend back in the day, which is probably why a lot of like nail technicians are Asians today. It was like the biggest trend to follow. It was our thing, I guess, our niche. And it was kind of cool. I thought I was kind of like helping out a lot. For me, it just made me feel important, I guess. And like, it was something that I had with my parents, like a bonding experience. So I was happy to do it for sure. And it was definitely difficult. I had to sit through a lot of weird conversations that I didn't even understand and that I had to then Google and try to figure out by myself.
关于找房子，你们什么困难？
刚开始来美国，我们打算租房子，但是由于没有信用，而且语言上的问题，经过我家人还有我朋友的帮忙，我们很顺利的找到了我们想租的公寓。
We started off with my uncle in New York, first of all, before finally moving to Michigan. My uncle had already started living there and started working there. We moved from Wales, Pembrokeshire, Wales, to New York, and kind of like as like our transition to start the American dream. Housing there was already kind of very tight because New York is a very tight place, and you can't find like housing for a lot of like spacious places. So that's when we kind of started moving to more economically forward states, which is why we moved to the Midwest in Michigan. I guess the biggest difficulties was just kind of like me being so young and not fully knowing everything. It was a lot harder to get housing at first. Once I got older though and was able to comprehend a lot more, then we were able to start getting houses and stuff like this.
I would consider Japanese Americans, Chinese Americans, even immigrants from South Korea. They are better off in terms of socioeconomic status than those immigrants from Southeast Asian countries like Bangladesh, Vietnam, or even Indonesia, Malaysia, or Philippines. For those, Asian Americans who have better socioeconomic status, I don't consider like access to those housing will be, very difficult for them because they typically live in independent housing. However, because we have Section 8 housing or low-income housing for those families, it's all about educating them about the awareness of those housing options. They can apply, to those housings. We do see a lot of old Asian Americans live in Section 8 housing. But still, the language barriers and the transportation barrier exist even when they move to Section 8 housing, which provides very limited in-home support or in-house support for them.
你们来了美国克服语言障碍？
刚开始来呢，我们都是因为都不会讲英文嘛，所以可是要工作啊，所以我们就都是朋友介绍，去中国餐馆打工，然后美国政府有提供给我们这些移民来的人，可以到 ESL 去学英文。就是早上去学一学，然后下午就用在餐馆上。
There's a Vietnamese church. I don't really know the American name of it. There's an American name for it that's different than the Vietnamese name here. Lá Vàng, and that's like yellow leaf. And it's a Catholic church, and they had a lot of like aids and like groups. I know a lot of them now are huge in like the Asian Pacific Islander Foundation here in Grand Rapids, and it's that church really that kind of started it all, and they kind of helped meet like your local like Vietnamese community, and that's kind of what helped transition. You meet a lot of Vietnamese people who are like doctors, lawyers, and stuff like that, and it's just kind of like a networking system to work with our own people.
Did you find any resources that were helpful, or were there any like extra services that they were able to utilize that helped that process?
Not many. So like unless they have their own resources readily available for them, like in terms of the service provider level, I believe there's lacking in terms of like addressing some language barriers or cultural differences felt by clients in general. So like Spanish or like other language might be a little bit better represented in terms of interpretation services. But in the terms like the private sector is way better. So like insurance company provide like a third party conference call whenever, which language do you use? Korean, whatever, then they just easily find some person onto another line, then we can just a third party conversation so that interpreter can. So, but public sector or like the social work area is a little bit lacking or like very slow.
Speaking of old Asian Americans who do not speak English as their first language, in some of the research projects I mentioned, I typically will have a student as a volunteer going to those Section 8 housing where they live and then provide translation services for them. So on a particular day, that's referring back when I was working with Arizona State University. So I have students come to the center or come to the housing facility once a week, and they will read the mails and translate those mails for those residents there. And then the other option is typically those housing facilities, they have a caseworker there, but they are not necessarily bilingual or coming from, knowing not about Asian culture. So they will seek help from us, from people who work in the community. So we were linking them to, say, Asian community centers or Chinese senior centers. So they will have like a language or translation help, services for those elders. So either provide students assistance directly or linking them to Asian service center to provide those language assistance.
What do you feel needs to be done in terms of advocacy to promote language inclusion among this community?
What I'm happy to see is if you visit a lot of websites targeting like public service or social service or your healthcare service for Asian Americans, now you can see they have multiple language versions. I would say Chinese Mandarin, sometimes Japanese, Korean. However, I want to highlight attention to those who, there are many Asian communities, like even in Michigan, I believe it's more than 30 or 40 groups here. So even we just, Asian Indians, Asian Chinese, Asian Philippines, those are top three. And Asian Indians and Filipinos, they are better off, in English than other ethnic groups. So we have to pay the difference within the Asian community, do not treat them as a homogeneous group. Some of them are better off in terms of language, as I said, the Asian Indians and the Asian, Filipinos. But we have to be careful when we generalize to the group. Some Asian Indians, they do not speak English well. But in general, then pay attention to those from Southeast Asian countries. They are not only suffering from language barriers, but also suffer from low socioeconomic resources, like I mentioned earlier group. I didn't mention there are specific groups that are from the refugee background. They're also from Southeast Asian. Typically, they are categorized in a separate group, and their services are handled by like those refugee settlement centers, like Catholic Charity. And Catholic Charity, they do provide translation and supportive service for them. But as in general, we have to include, all Asian, particularly those small Asian communities. And what I'm happy to see is, when during my teaching at MSU, I encountered those students, college students, from those small communities. Like I met someone from Bhutan or Burma. They are representing their community. They are young college students like you guys, and they are representing their like small community, acting as an active agent and an advocacy agent. So they bridge the gap between, they educated their old parents or old grandparents, doing the translation, transportation, and also bringing service to the community. Like in Grand Rapids, there is like a Bhutanese community there, refugee community, and I have been there before. And the older adults do not speak English, and the young person serving on the community board, they are bringing the service to the community. Also, if you can bridging out to Latino or African Americans, and learn from them, I think in some ways they are much more experienced in advocacy than the Asian. Asian community typically is considered as the role model for immigrants. They like working hard, work diligently, but ask for less. But if you can learn from other ethnic communities, immigrant communities, we can actually build a larger coalition to have a more powerful voice. So that's the tip. We shouldn't work as like just one group.
Probably first of all, as I mentioned earlier, like making some translation interpretation service available using technology, right? Or like letting them know the availability of the technology or some resources. So most of the times, social students would understand, it's not like the lack of resources. It's kind of lack of knowledge, where to find, which is available, and kind of thing, what's the process. So if we have some guidance about that, like it can be repository, or it can be some, I don't know, some network or something that can be delivered to them by means of, I don't know, handbook or brochure or like some signage. So that may be helpful.
But one thing we have to be aware is we shouldn't work in silos, because I'll say if I'm interested in Asian, then I'm not attending African Americans event. I'm not attending like Latinos events. That doesn't help. In the small Asian communities, we tend to be united. There are some separations, but they have to be united to advocate for more resources. If you do not partnering with, say, I'm Chinese, I'm not partnering with Filipinos, I'm not partnering with Vietnamese communities, then there is no, I don't think there will be effective advocacy. So only when you're united, you have much more a chance to be heard.
I guess what's really important is just kind of community. If everyone kind of did their part to help out kind of everyone just a little bit, it would just make life a lot easier, honestly. Everyone is currently, especially now, so set on do you first. I'm doing me, and we fully forgotten community, and I think that's a huge issue that we have, that mindset with our current people. And if we just have more people with a mindset that we should build a strong community together and be more open to everyone, I think that is just what everyone needs, to kind of culturally accept everyone